Let's talk about the hottest thing that's taking the world by storm. That's right, we're talking about the new coronavirus. Is this finally it? Is it the big one? Honestly, it's hard to say, but it's moving fast and it doesn't look good. What started in the city of Wuhan in early December 2019 has now grown into a global health emergency. It's hard to miss considering the media coverage it's receiving. And as the infection spreads beyond China, so does the unease. But don't worry, it has a low death rate. Currently, all four corners of the globe express their concern in regards to the virus. And with misinformation being spread like butter, fear is at an all-time high. But it shouldn't be. So please, calm yourself down. Because to truly deal with something, you'll have to understand it first. We all have questions, and to find the answers for them, we need to look at the virus and its history. So in this video, we'll dive deep into what is the coronavirus and where did it come from. So sit back and relax. Coronavirus, believe it or not, isn't actually just a singular virus. It's one big family that mostly wants your respiratory system. Each member of the coronavirus family has their own level of deadliness, ranging from inconvenient to incredibly dangerous. The story begins back in the years 2002 to 2003. 774 people died from severe acute respiratory syndrome, or SARS, first reported in Guangdong, China. It then spread across a number of countries such as Hong Kong, Taipei, Singapore, and Canada, with over 8,000 cases at its peak. It reappeared 3 times throughout the years, but as of 2015, there were no further reports of SARS cases. Then in 2012, about 858 people died from Middle East Respiratory Syndrome, or MERS, which first appeared in Saudi Arabia. It didn't stop there, and proceeded to infect other countries in the Middle East, Africa, Asia, and Europe. In April 2014, the first American was hospitalized for MERS in Indiana, and another in Florida. Both had just returned from Saudi Arabia. After that, there was an outbreak of MERS in Korea, which was the largest one outside of the Arabian Peninsula. As of December 2019, MERS is still doing work, but the world is more ready to deal with it than ever. That's the problem with these types of viruses. They seem to pop out of nowhere. MERS and SARS coronaviruses that we've experienced were already hard to deal with. But in early January 2020, the World Health Organization identified a new type of virus from China. Discovered in the very last day of 2019, it started in Wuhan, which is pretty ironic considering that's where the Wuhan Institute of Virology, a biosafety level 4 laboratory, is. Anyways, an investigation was made at the start of the year, and yes, as we already know, this is Covid-19, or the novel coronavirus. More infectious than SARS, this kind of strain hasn't been seen among humans before. The theory is that it may have jumped from animals similar to SARS into the human population and thus begun spreading. Based on the news all across the globe, the virus has killed thousands of people. And this pandemic isn't stopping anytime soon, with over 650,000 cases being reported as of making this video. In order for us to really see the scope of the virus, let's run a quick review, shall we? By the end of 2019, the city of Wuhan becomes ground zero for COVID-19, with cases starting off as what was seen as an unknown type of pneumonia. According to the authorities, some of the patients were vendors in the Huanan seafood market. The World Health Organization decided to monitor the development of the virus in case it went big. And spoiler alert, it did. On the 4th of January 2020, it was announced by WHO that they were investigating further about these cases as more people with pneumonia popped up in the same city. A study that came out on the 25th of January 2020 notes that the individual with the first reported case became ill on the 1st of December 2019 and had no link to the seafood market whatsoever. Investigations are ongoing as to how the virus originated and spread. By late January, there were multiple confirmed cases in China and a death count that was rapidly rising. From there, the virus spread to neighboring countries, and the Chinese government decided to lock down the entirety of Wuhan. Airlines pulled flights, trains stopped running, schools and businesses were closed, and people were told to stay indoors. And all was well in the world. Right? Wrong. Simply put, while China was fully prepared to deal with an outbreak like this after experiencing SARS more than a decade ago, COVID-19 proves to be too much. And the ride doesn't stop there. Even with the initial lockdown and the airport screenings, COVID proves to be a global health emergency, finding its way to Europe, America, Asia, Australia, and even parts of Africa. That ends our quick review. Often a coronavirus can infect both animals and humans. Scientists have claimed that, similar to SARS-CoV, the origin of the virus was zoonotic in nature, or in layman's terms, it came from an animal. It has been said that what is spreading now is related to bat coronaviruses, most especially from the horseshoe bat. I guess bat soup was a bad idea after all. Even with those claims, there has been a great deal of speculation about the source of the new coronavirus. Is it natural? Is it man-made? Soon after the first cases came to light, various conspiracy theories were being passed around by word of mouth or through the internet. People were pointing fingers. Some were pointing at the Wuhan Institute of Virology. Others, like Chinese officials, were accusing the good old US of A for bringing the virus into the country, and many more insane theories. But truth be told, the real concern right now is how to deal with it. A number of renowned scientists issued a statement condemning these conspiracy theories that suggest that COVID-19 does not have a natural origin. So people are concerned since we don't exactly know the severity of the disease or how far it will spread. With that, every other country and their citizens have taken preventive measures in order to combat the virus. These measures range from reasonable to completely insane. Please stop the hoarding and the panic buying. You guys are making it worse. When a new virus emerges, we often have to learn much more about it, and one of the things that we ask ourselves and others is how it transmits from person to person. We know that most respiratory viruses are spread by large droplets that come out when people cough and sneeze and stay aloft for varying amounts of time. They land on surfaces and can also be transmitted between person to person by touching said surfaces, such as doorknobs and others. Other viruses can spread in the air and stay aloft for a long period of time in small droplet nuclei. Coronaviruses spread the same way. The current one we have transmits from droplets of mucus spread out on surfaces and in the air that an infected person puts out. So yeah, best avoid people coughing and sneezing, and also don't randomly touch things and then touch your face. Remember what SpongeBob said, licking doorknobs is illegal on other planets. Don't forget to disinfect. Washing your hands is the best way, but if you don't have access to that, some sanitizer can do the job. Truth be told, getting infected comes with a lot of problems. One of the problems is it's real hard to tell if you have it. It might just feel like the common cold. What we do know is that there's cough, fever, and even shortness of breath. But severe cases involve pneumonia, kidney failure, and at worst, death. The CDC does not advise that healthy people wear face masks, but they should be worn by coronavirus patients to help slow the virus. Scientists are already making strides with test kits and vaccine development. A vaccine, of course, is the long-term solution, and developing one takes time and costs millions of dollars. So, of course, all of us have our fingers crossed, and we're hoping for the best. Right now, it's all about the emergency response. We're talking about treating millions of people. People under investigation, quarantine, or actually suffering from the virus itself. Many of them are suffering alone in hospital beds, away from their families, and most likely scared out of their minds. Let's do our best to make sure that the numbers don't increase faster than it should. Here's the general advice from the experts. Stay away from sick people And if you're ill, go get yourself checked immediately. And we've reached the end of the video. Thank you for watching all the way. So that was a crash course on what the coronavirus is and where it came from. Don't be afraid to leave comments about how you feel about the pandemic and the things that we might have missed. Your words always mean a lot to us. And as always, don't forget to like, share, and subscribe. Stay safe and see you in the next video.